welcome back to another episode of Guidepost in Motion, a podcast highlighting risk, compliance, and security professionals with insights meant to keep you, your business, and operations moving forward. My name is Bradley Dizik, and I am a Senior Managing Director at Guidepost Solutions. Joining our podcast today is Dr. Mary OConnor. Mary is the co-founder and Chief Medical Officer and Chief Compliance Officer at the healthcare startup Vori Health, which launched earlier this year. Vori Health is an all-inclusive medical and healthcare provider practicing a holistic, integrated approach, starting with musculoskeletal care. The organization offers full-service physical medicine and rehabilitation care in a virtual setting. And today, Mary is here to talk to us about the compliance challenges of starting up a virtual healthcare practice. Mary, thanks for joining us today.
Brad, thanks so much for having me.
Mary, you have had a distinguished career, spending 23 years at the Mayo Clinic before joining the Yale School of Medicine for several years, and now you're a co-founder of Vori Health. Before we jump in, please tell us more about your background and what led you to becoming a co-founder of a virtual healthcare startup.
Brad, delighted to share with you and our listeners a bit of my background. So I'm an orthopedic surgeon. I did my training at Mayo Clinic Rochester and then was asked to join the staff at Mayo Clinic Florida. I had numerous leadership positions. I was chair of the orthopedic department, a member of the executive operations team in Florida, but I also had an enterprise level leadership position as the medical director for the Office of Integrity and Compliance. And I learned a lot more about compliance in that role and the importance of it. And basically, it helped me shape a philosophy, which is compliance is important. It serves to provide guide rails for an organization, but it's also really important in medicine that we see compliance as a way that we want to support our mission. And how do we align our approach to compliance with our fundamental value of providing care for patients and communities? And we can get into that a little bit more later. And so after Mayo, I went to Yale to lead the development of an integrated musculoskeletal center, and then had the opportunity to co-found Vori Health and realized that it was just a very exciting opportunity to take the concept of integrated care to a much higher and broader level and really transform the delivery of musculoskeletal care to drive not just a better patient experience and clinical outcomes, but also, of course, lower costs. Because, I mean, we all understand the challenges that everyone faces with rising healthcare costs.
Thanks, Mary, for sharing your background. When we think about Vori Health, we think of a company, even though it's a startup, that's at the forefront of healthcare. Vori is actually very different from most other virtual healthcare companies. It has its focus on musculoskeletal issues. When I think of musculoskeletal issues, I think of an orthopedic surgeon. Can you talk a little bit more about what differentiates Vori Health and what problem Vori Health is trying to solve?
Thanks, Brad. I'm delighted to. So we are a virtual medical practice that is tech-enabled, and we understand that there's a lot of care that currently is delivered in the face-to-face setting. The traditional way, people have gone in, they see an orthopedic surgeon, or they see a spine surgeon who could be an ortho surgeon or a neurosurgeon, and that's how they get their care. We also know that there's a certain percentage of surgeries that are either inappropriate or unnecessary or potentially could be avoided if there was better non-operative care up front. And we see that as a focus of our mission, right? We want to deliver great non-operative care, driving convenience for patients and value through the virtual setting. And then some patients will still need to see surgeons and we'll refer them to great surgeons. But we see the opportunity to really drive great outcomes for patients with a focus on let us work on helping you get better without surgery. And you know what? If you need surgery, we get that. We'll get you to a great surgeon. We see our value as being an interface between that primary care physician and the surgeon to really drive expert, holistic, non-operative care with health coaches, non-surgeon musculoskeletal physicians, advanced practice providers, physical therapists, of course, and nutritionists, and really looking at the patient from a much more holistic approach. So we're very excited about what we're doing, and we've had incredible patient experience scores to date.
Awesome. And Mary, we're very excited as well, to have Vori in the healthcare marketplace. And, usually when you think of, healthcare marketplace, startups in particular, you think about lean, mean machines. You think about, limited resources, limited capital, and, usually they put that behind the business, and compliance is an afterthought. And, history has proven and showed, Uber being, probably the prime example, that when you focus just on the business and you don't think about compliance, you run into problems. And while your business is growing, you have to become reactive. And the CEO and the leadership then have to start spending precious time, solving and responding to crises, to compliance issues. Vori, however, made a different choice. Vori decided to hire Guidepost before it even launched. Vori decided strategically to make a commitment and an investment into an ethics and compliance program to define its values and its behaviors, what it wanted it to be culturally. Can you talk a little bit about your thinking in doing it that way? Why did you take precious resources, limited resources, and invest in an ethics and compliance program with Guidepost before you even launched?
Brad, the answer is that compliance should be seen, in my opinion, as the guide rails, as kind of the framework upon which you're building a great company. And you can either do the work up front and actually make the work more efficient, or you can do the work on the back end where you're basically having to clean up problems that have occurred because you didn't invest in the beginning. And so I think it's just simpler and easier to do the work up front, at least the basic work of your basic policies and procedures. And it also does help set the right cultural tone and ethical tone for the company as to what you believe in and what your values are.
That's excellent. And just to kind of, go off that, to talk a little bit about, values and culture, you, the CEO, Ryan Grant, who's an absolute visionary, really honed in on the need to establish a culture out of the gate. Your employees are located, across the U.S. I think you even have some in Canada. And you're a virtual practice. You're not a brick and mortar practice, at least out of the gate. Can you talk about a little bit about how you went through the process of defining your values, defining your culture, and who you wanted Vori to be?
Brad, that's a great question. And I think like most startups, we created our vision and mission statement, and we really identified that our purpose is to empower humanity to live its best life. And in order to do that, one needs wellness and health. So we looked at the values of providing care for patients, of transparency, of integrity, of all the kind of traditional values that you would imagine a healthcare company would have. We have those. But I think one of the values that we've really emphasized is viewing patients, again, in that much more holistic way, and getting away from the traditional medical structure of, treat it, fix it, treat it, as opposed to finding out what matters to the individual. What are their goals? How do we help them improve their wellness journey, move them even into a wellness journey if they're not on one? And that requires a much more integrated approach. And the challenge in the traditional system is they haven't approached it that way because nobody pays for that integrated care to happen. But as we see the healthcare system moving towards more of a focus on population health, and we see groups, particularly primary care groups in at-risk contracting, then those are people that very much understand and see the value of what we're doing. And those are early partners for us.
Wonderful. And, thinking in terms of the values and behaviors, working with you, I know that those were captured in a code of ethical conduct. And that code of ethical conduct, I believe at Vori stands as kind of the foundational document of who Vori wants to be and how Vori trains to who it wants to be culturally.
Absolutely. I'm not saying anything that you and our listeners don't know, that it's always about the people. It's not just the people, it's all about the people. Particularly in a startup, early hires are critical. And of course, we won't always knock it out of the park, but I spend a lot of time on the clinical side recruiting the right people. Excellent.
And you have a very distinguished career in the healthcare industry, particularly in a traditional setting. And in that setting, particularly through your work at Mayo, you have always had to adapt to policies and procedures in a very heavily regulated industry. And you ensure your staff is compliant as they go about their day-to-day jobs. With Vori Health being a virtual startup, what was different or unexpected when it came to building a compliance and ethics program and functionally just making sure that you mitigate against the risks of something going wrong? Can you maybe talk about it in a specific, in terms of a specific example?
So, Brad, that's another great question. It's funny because despite a lot of telehealth that has developed, particularly accelerated by the pandemic, I've been surprised as I've gotten down into some of the weeds with some of the challenges that one can encounter. And I'll give you a great example. So we were working on a policy of, what happens if one of our clinicians is in a Vori Health visit, a virtual visit with the patient, and they have chest pain, or they fall, or they collapse, right? In the traditional medical world, I'm the doctor, the patient's in the office with me, they collapse. I call, for the emergency team to come, or I call 911. And, people come and respond, and the patient is taken to the emergency department to receive the right level of care. Now, in the virtual world, we don't have that, right? We had to create a policy. All right, how are we going to deal with this? We're going to need to reach out to local emergency services, and then that's pretty straightforward. But when you start to go deeper and you realize that 911 is basically a local service that is administered on a county level, then it becomes a little bit more complex, where we had to work into our policy verifying the location of the patient, so that if, heaven forbid, something were to happen to the patient and we would need to call emergency services, we would know where are they so that we can find the right service to call.
Mary, I find that absolutely fascinating. And when you add on the fact that your employees are working from home, they're remote, and that they have to make ethical judgment calls, can you talk a little bit about how they're adhering to the policies as well as the law when making those ethical decisions?
Brad, I don't really see a challenge with the ethical decision, because it's pretty easy to understand if you think the patient needs help, like in the example that I just gave you. And the ethical decision simply comes down to, if that was my loved one, what would I want done? So we want to treat our patients as if they're part of our family. Now, there can be other potentially more challenging ethical situations where one might be concerned about, for example, did someone on the team put the right bill in, right? Is something more along the line of fraud and compliance, which are separate issues than patient-facing issues. And again, that's where having a good policy that says, here's how we're going to bill, here's our criteria for billing, for example, and here are the guide rails, helps everyone understand what the right approach is.
Fascinating. And, when you think about it, these are humans, these are people that in some ways you don't know until you've had a chance to work with them. You are working in a highly regulated industry. Can you talk a little bit about, some of the exhausted search criteria? You simply can't conduct a basic due diligence on potential hires. What do you think is effective due diligence that can potentially save, Vori and other businesses from risk of financial losses and reputational damage?
Well, that's of course that's the $1 billion recruitment question, right? How do you find the right people? So I look for people that have the right values, because I need to know that they're aligned with what we're doing and how important our patients are to us. So that's kind of my number one criteria. Do you have are you going to put the needs of the patient first, to basically, quote the Mayo Clinic value? We put the needs of the patient first. Secondly, I want to know that you are able to work effectively with an integrated team, because it is all about the team here. It is not about an individual person. And the third thing, which you might find interesting, is it's really important to me that people are going to be comfortable speaking up. I tell all our new hires that one of my favorite sayings is, leaders are guardians of the learning system, and leaders are responsible for ensuring the psychological safety on the team. And if people are not comfortable speaking up, then I feel that I would have failed as a leader. And we can only get great when everyone contributes, which means that people have to be willing to speak up. So I find those three things are my basic top three criteria when I'm looking to recruit.
That's wonderful, Mary. And it sounds, just to bring it full circle, that you're basing these decisions on the work that you did before you even launched, by putting in place an ethics and compliance program, building out a code of ethical conduct, taking Vori's values, putting in that code of conduct, defining, your other expectations, your ethical expectations, through your policies, procedures, and you're looking for folks who mirror that. And as they do the day-to-day business, are asked to make ethical decisions.
That's absolutely correct, Brad. And again, I think that at least for us, it was a great decision to do that work, the compliance work up front, and really create that framework, which we used as the foundation of building other aspects of the company.
Awesome. Well, thanks, Mary, for sharing this, fascinating and really informative, conversation and information. I know you have a lot more to talk about, but that is all the time we have for today. I'm looking forward to our next podcast. Mary, thank you so much for being here. I'm sure all of our listening audience would agree when I say that this was a very informative and fascinating conversation.
Thanks, Brad. I'm looking forward to our next discussion as well.
Thank you to our listening audience for tuning in today for another episode of Guidepost in Motion. I am Bradley Dizik, Senior Managing Director, Guidepost Solutions, and please join us again next week when we welcome back Mary O'Connor to talk about privacy challenges with utilizing work from home employees, and Mary will also share her compliance advice for those looking to launch their next startup. Until then, if you need assistance assessing your compliance program or building one from scratch, just like Vori Health did, please visit our website at guidepostsolutions.com.